howdy. I'm Xander Holloway, and I'm in Group 1 along with Hallie, Mia, and Ashley. And I will be discussing what our diagnosis was and what symptoms led to our diagnosis. So to start off, we would diagnose this man in case study 1 with meningitis. I'm going to quickly go over the basics of meningitis, but it will be covered in greater detail later. So meningitis is an infection of the central nervous system and is caused by an infection which is most often viral, but it could be bacterial or a fungal infection as well. Meningitis can also be very deadly, and it's important to seek medical help as quick as possible. And some symptoms that the man had, which were evident and would lead to us looking further into meningitis prior to any bedside tests, were his high fever, which clocked in at 102.2 degrees Fahrenheit, a confused state. He also vomited, but only once. He had feelings of nausea, felt overly tired as the day progressed, as well as being very sensitive to light. So the bedside test, which we would look at, would be the Brudzinski and Koenig sign, which are tests that have been used for over 100 years. Brudzinski signs looks at neck stiffness and observes how knees and hips bend when the neck is flexed. His Brudzinski sign came back positive, which would point further to our diagnosis that he was suffering from meningitis. The Koenig sign looks at resistance or pain when the knee is bent to a 90-degree angle and the leg is slowly straightened. His Koenig sign came back negative, which at first had us worried in our diagnosis of meningitis, but after further research, we found it was quite common for someone with meningitis to have a negative Koenig sign. One study found that only about 12% of those with meningitis actually have a positive Koenig sign, which got us to thinking that these have been around for 100 years and it may be time for some new tests. And another test we would like to run on this subject would be a polymerase chain reaction, PCR, which is the gold standard tool for diagnosing meningitis. This PCR detects and quantifies viral DNA and RNA in patients' cerebrospinal fluid, or CSF. But the problem with that is obtaining CSF can be very difficult, so blood and other specimens are sometimes used. And not everyone, the PCR is not available in many places due to the cost and how difficult it is to use. So there's a growing need to develop the rapid diagnostic tests. The RDTs are cheaper, easier to use, and the results come back much quicker. Some examples of these RDTs would be the latex agglutinin test or the immunochromatographic test. And that's all I have.
So, as stated earlier, meningitis is the swelling/inflammation of the protective membrane that covers the brain and the spinal cord, and the swelling and inflammation is caused by an infection, either bacterial or viral, of the fluid surrounding the brain and the spinal cord. There are other factors which can lead to an individual developing meningitis, such as parasites or fungal infections. There are also several other factors such as injuries, cancer, certain drugs, and different types of infections which could also lead to an individual to develop meningitis. Symptoms of meningitis may also replicate those of influenza. So as stated earlier, there are specific tests an individual can do to differentiate between influenza symptoms and meningitis symptoms. An individual will actually experience these symptoms because the body is trying to fight off the infection. So the virus or bacterial infection causes an individual to get a fever, and a fever is part of the body's natural defense mechanism. So by making the internal body hotter, it actually causes or it creates an environment where it is harder to survive in for that virus or bacteria. And an individual would experience a stiff neck if they have meningitis because of the cerebrospinal fluid and the surrounding meninges becoming infected. And so due to this infection, they become swollen. And this would then stimulate and activate specific nerve fibers, which then result in an individual to have that stiff neck. If the swelling of the infection contributes too much pressure on the brain, that is also why an individual would experience vomiting and confusion.
Hi, my name is Hallie. So today I'll be discussing the different treatments used to treat meningitis and how often it occurs. So there are around 2,600 cases of meningitis per year, with 1,400 of those cases being in children, with 70% of meningitis occurring in children aged 5 and younger. Males are more affected than females, and children under 2 years old are at the highest risk of infection. In the first month of a newborn's life is when most get meningitis. Meningitis can be caused by several different infections, and with different causes, it leads to different treatments. Those cases caused by Haemophilus influenza affect 0.2 in 100,000 individuals. In the U.S., when the cause of meningitis is caused by pneumococcus bacteria, it affects adults more than children. This is a result of a vaccine that both men and women get when they are older. And this usually affects 1.1 in 100,000 individuals, and usually doctors prescribe antibiotics, and sometimes corticosteroids are used for treatments. Doctors use this treatment to help ensure recovery and reduce the risk of complications such as brain swelling and seizures. Patients that have meningitis with an unknown cause start antiviral and broad-spectrum antibiotic treatment while the cause is determined. Once it's determined, then the doctor will prescribe the proper treatment and antibiotic needed. Patients that have viral meningitis are usually on bed rest with plenty of fluids and over-the-counter pain medications. And a doctor may prescribe a patient corticosteroids to reduce swelling in the brain and an anticonvulsant medication to control the seizures that could occur.
Hi everybody, my name is Ashley Story, and my part of the presentation will be discussing who is most at risk for contracting meningitis and which diseases could lead to misdiagnosing due to similar symptoms of meningitis. So the ones most at risk include adolescents, young adults, and children under the age of 1. As well as some groups of people that have different living accommodations. So people that live in dorm rooms or military barracks, or like anything where there's a bunch of people in one living space, because the disease can travel from person to person. Lastly, there is also a high risk for people that travel outside of the country, or people that just are not used to the environment that they've been around, like traveling to a new school or a new state or anything traveling wise. And then there's also some lifestyle factors like smoking often, or improper sleeping patterns that people are just not used to. And then there are many diseases that one can contract. And because of this, it is hard to specifically diagnose the exact disease that one may have. And as for meningitis, some similar diseases can be meningeal carcinomatosis, which is described as a cancer where the cancer cells move from the original tumor to the meninges. And because it's a tumor, it will cause the meninges to become inflamed. Another disease could include the central nervous system vasculitis, and this is where the blood vessel walls become inflamed due to or near the brain and spinal cord. As well as their last disease is leptospirosis, and this is caused by a bacteria of the genus Leptospira. And symptoms of this disease can include high fever, headache, or vomiting. And this specific disease can lead to meningitis, which is why some people may mistake it for meningitis, or if they don't catch it. And these 3 diseases are just a small list of many diseases that can be mistaken for meningitis. Thank you.